I'm Dr. Churan at the Animal Clinic of South Elgin. This is my assistant Jenny, and this is our clinic cat, Stewart. He looks like a ragdoll cat, but he's actually a stray out of a barn, and he doesn't have any known parentage. But he has many of the characteristics of a ragdoll. He's a Siamese mix. And what we're going to talk about today is the importance of a physical exam annually for cats. Now, Stewart is a young cat. He's about 4 years old, but even young cats should have annual physicals because we want to catch any problems before they become big problems. So annually we like to give them vaccinations. Rabies vaccinations is required by law, even if your cat is only indoors. We also recommend distemper shots, which has 4 actual different components. And depending on your cat's lifestyle, we do have some other vaccinations which may be appropriate. So when we do a physical exam, what we want to do is we start at the front and we're looking at his face. We want to check his eyes for any abnormal discharges. We want the pupils to be the same size. We don't want any discharge from the eyes. We don't want discharge from the nose or discharge from the ears, which would be a sign of an illness. We look at the ears with an otoscope, which is similar to what people would have. And basically when we look in the cat's ear with an otoscope, we're looking deeper for perhaps ear mites or ear infections or foreign bodies which could have gotten into your cat's ears. And obviously that would cause discomfort as well as infection to your cat. Their nose should be clear. We shouldn't have abnormal discharges from their nose. We want to look at their face, and they should have a nice clean face without sores or wounds on it. We want to look at their teeth, pick up their gums, look at the teeth, and what we're looking for is any abnormal tartar or any foreign bodies, sores, wounds, or masses, which would be like oral tumors in their mouth. So we want to check on that. They have lymph nodes, kind of like people, right at their jaw here. So we want to feel to make sure that that is normal. We put our hand down the cat and we want to feel normal body weight. Stewart is a happy eater. He enjoys to eat, and we enjoy to prevent him from eating. So it's a constant dilemma, and sometimes we're winning and sometimes Stewart's winning. And just like people with multiple cat households, it's difficult when you have some skinny cats that you're trying to get fatter and some fat cats that you're trying to get skinnier. But we want to evaluate that, and just like people, having an ideal body weight is always beneficial to health. We also want to look at skin and coat. We want to make sure they're not too dry. Sometimes in the winter, their skin gets very dry, just like people, where they would benefit from a supplement to help that. We also want to check for parasites, which even indoor cats are known to get parasites because fleas can get on people's clothing or shoes, or sometimes people have a dog that goes in and out. So even though their cat is indoor only, parasites may be brought into the home, which then will attach themselves to the cat. So we always want to look carefully to make sure that we don't have any parasite problems. Checking their abdomen, we just want to take a gentle palpation and feel of their abdomen, make sure that we don't feel anything abnormal. And in female cats, obviously, we want to check and make sure that the breast line is along there, that we don't have any swellings or abnormal masses there. Then we go to their tail, which should be, non-painful. Check their rear end area for any discharge, parasites, problems like that, any sores. And other than that, we're good with our external palpation. Then we like to check their use a stethoscope. We're going to check the heart, we're going to check the lungs, make sure that that all sounds pretty normal too. And Stewart, of course, is very cooperative for that. Stewart is a beautiful cat. You are good. And Stewart sounds very good today. Stewart is on a monthly parasite prevention. He is a clinic cat, And so, of course, we have many other pets in and out of the clinic. So being preventative with parasites is always important. And it's way better to prevent problems than to wait until you have problems and try and get rid of them. So just because of the environment that he lives in, prevention of parasites is very important. And so that's what we do for Stewart. And that's what we recommend for everyone's cat.